Hello everyone. Yeah, I'm your host again, Stan. So today we are holding a big ABC Prevention Summit in 𝑤𝑒𝑏𝑒s𝒄, and today it's our pleasure to have Dr. Azaripour to 𝑤𝑒𝑏𝑒s𝒄 and share some experience. So please say hi to the audience.
Hi everybody.
Yeah.
Nice being here.
So first of all, could you do a brief introduction for yourself?
Sure. Well, my name is Adriano Azaripour. I'm a periodontist from University of Mainz in Germany. I'm working since the 2008 actually, 2008 in the Department of Periodontology. And since 2016, I opened my own dental office. And well, now the most of the time I'm working in the office, but still I'm in the university once a week. So I have a bilateral type of my work.
Gotcha. Yeah. So today, is this your first time in grading in
Yes,
𝑤𝑒𝑏𝑒s𝒄?
yes, absolutely.
How do you like the city?
Beautiful, beautiful. We just arrived last night, so I'm really still curious to see, but the first impressions were really great.
Yeah, maybe let's back to maybe our topic today.
Yeah.
So today, because we are talking about the prevention, so my first question is, how long you've been using the air polishing in your daily practice, and how do you see the value of air polishing?
Well, actually, we are using that from the very first beginning. Actually, also when I was a student, we had these small devices, the hand pieces.
Okay.
We could add to our dental chair. So at that time, we were working with that. And then later, of course, then we had the whole devices, which we had the ultrasonic and the air polishing together. So,
yes.
Well, I can say I'm using that maybe for 18 years or something like that.
Okay. Yeah. So how you see maybe the value, maybe compared to normal polishing or some profi? So how do you see the difference?
You mean between the complex devices or only the air polishing, or air polishing comparing to normal polishing?
Yeah, air polishing compared to normal polishing.
Well, if you're doing a periodontal treatment, I think in most of the cases the air polishing is completely enough. Mm-hmm. There are always some edges where you want to really maybe do a special polish treatment there, then you need additional polishing devices. But for the normal periodontology, we always do the normal air polishing. Of course, combining different materials.
Yeah.
You cannot, like when you have a patient with a lot of plaque, we start with sodium bicarbonate, and then we end up with erythritol to polish it in a fine way.
Gotcha.
If you start with an abrasive material and did it like that, then of course that's
yeah. So it's very important to choose the right powder. Right?
Exactly.
Okay, gotcha. So yeah, as today maybe the lecture is about using or combining the prevention with the microscope. So how do you see the value of using microscope doing the prevention? Well,
I started my career as an endodontist before I did the perio. And of course, at that time, the endodontic treatment was always under the microscope.
Right.
And I was doing the surgery using loupes.
Okay.
Today, I'm actually doing everything under the microscope. But the reason are some important points.
Okay.
One of the most important points using a microscope is the ergonomics. The way you sit behind the microscope.
Yeah, exactly.
So that's good for your back.
Okay.
We as a dentist, we have always problems with your back. So to avoid some disorders, the ergonomic benefit using a microscope is enormous. So that was very important.
I see.
The second important thing, another important, not the second as the importance, is the light. The light, the amount of light you get when you're using a microscope is perfect, right? So you have always a perfect amount of light where you need it, exactly where you need it.
I see.
So the people, because when you talk about microscope, they directly think about the magnification.
Right.
Of course, the magnification is the very important issue, but beside of that, the light and the ergonomic benefit using a microscope is huge.
Gotcha.
So yeah, so I cannot do anything without the microscope, basically.
Gotcha. So you think the microscope is not only maybe deliver a better clinical result, but also take care of that people are using the dentist.
Of
right?
the dentist's health, of course.
Gotcha.
Absolutely, absolutely.
Very good
And
point.
the benefit, of course, the magnification and the right light gives us a more precise situation to understand what's going on.
Okay.
And of course, when your assistant is working with you, you need to give her or him the possibility to see what you're seeing, so she knows how to assist you in that certain point, right?
I see.
If you're saying something and they're like acting like why she's not reacting, of course. So,
okay, good point. Good point. Yeah, and because also today the summit is more about the prevention. So when it comes to the prevention and the treatment, so how do you decide whether to treat or keep monitoring? So what kind of protocol or measure you are using, like probing or see the bleeding, or how is your normal protocol?
I mean, as a periodontist, the prevention is the best therapy.
Okay.
And monitoring the patient is very important to decide when is the right moment to treat, or is it needed to treat.
Right.
So monitoring, of course, means probing, staining, and controlling these two things over a long time gives you an exact result when is needed to treat the patient, right?
I see.
And doing that, also having this fixed treatments with the patient is very important, because when the patient knows, oh, next month I have to go to my dentist again, they would take care more than, okay, we treat you and you come maybe back in 2 years, right?
So that's very important. Okay. Maybe could you share a little bit more about your experience with Woodpecker?
Well, with Woodpecker, actually, I'm using their devices in different dental disciplines now. I have the first, I started with the eye motor. That was
endomotor.
As an endomotor.
Right.
And now since a year, I have the 812MT, which is a great endomotor. You have the apex finder inside. You can adjust the motor in all of the combinations what you want, rotary, reciprocating movements, and you have different hand pieces for using different movements also. So it's a really great device.
Thank you. So using more endo, maybe at the very beginning, right?
That's exactly what I started with, to work together with Woodpecker. That was the first the step we started with. And the next one was actually the new devices we gathered only at the beginning of the year, so they're pretty new. One of them is the DTE, the prophylaxis device. The combination of the powder and how you say?
That is I think it's the PDE unit that we're just launching in the IDS meeting this
Exactly.
year.
It's a really new machine, ultrasonic movements and the powder polymer. So it's a great machine. You can also there decide how you can adjust everything, the temperature of the water for each the device, the ultrasonic movements. And it's a very stable machine.
I see.
And last but not least, we have the 𝒂𝒊𝒂𝒂𝒂, which is a combination of endomotor and a piezo motor.
Yeah.
And it's just as big as a normal implant motor, and it's a great machine.
Yeah, I don't expect that you are using the 𝒂𝒂𝒂𝒂 yet, because we are not really launching or officially, because it's just a new launch.
You see, I'm always very fast.
Yeah, thank you. Yeah, I think you have a good experience with our products. Thanks a lot.
Yeah, they're really good. We really love them.
Maybe one last open question I want to bring is maybe talking about the prevention or the air polishing. I would say, because I'm in charge of America, like North America and Latin America, and also I just visit some Asia country. I would say the penetration of air polishing is not as good as maybe you do in Germany. Maybe I would say even in North America, there's less than 5% of clinic that are using the air polishing. So why maybe in Germany the air polishing is so popular there?
I think, I'm not sure, but a lot of clinical studies has been done in Germany at the beginning of the 2002, 2003. There are a lot of studies where we were published to see the efficacy of using air polishing system devices. And of course, the devices were produced in countries where, so we had them there.
Okay.
That's, I think, one of the reasons we started before maybe the American market. So because as long as I know, the first air polishing systems for dental use was coming from Switzerland.
Oh, right.
So one of the first devices, and beside of that, having the clinical trials together, I mean, that moved the German market faster using the air polishing systems.
Yeah. So I agree with you. So you think maybe that unit can, for sure, it gives a better clinical result, right? So that's the key point.
Yeah, like I mean, I cannot give you a certain number, but I don't know any colleagues of mine which is not working.
Okay.
So,
gotcha. So in your opinion, are you encouraging everybody to try the air polishing, or you think maybe they can stick to what they want?
I mean, everybody should try. And of course, there are some risks using air polishing systems, like when the periodontal pocket is open and you take it in the wrong angle, you can cause some damage.
Right.
So you have to be good instructed how to use it.
Okay.
But it's not difficult.
I see.
It's not like you need a lot of time to know how to work with it.
Okay.
You learn it very fast. You have to keep in mind what you shouldn't do to destroy some periodontal structures or to cause some damage to the patient.
Okay.
But knowing how to use it, using the right powder, you're gonna love it for sure.
Okay. Good. Yeah. Thanks for all the experience, all the opinion about the prevention and everything about we share to your fans. Thanks a lot.
Thank you very much for the invitation. Thank you.